MicroGuide is used within University Hospital Southampton as a software platform to disseminate guidelines and clinical information to our doctors and directly to their mobile devices, but also to laptops and iPads, etc. The aim is to make the information accessible promptly and easily, and to allow doctors to drill down to find precisely the information they need. And we hope that allows them to deliver safe and effective care and improve outcomes for our patients with infection. The DSM, or Decision Support Module, is a way of allowing us to tailor antibiotic treatment more closely to individual patients. So when the doctor makes a diagnosis and they'd like to choose an antibiotic treatment, they call up the DSM screen, and the screen prompts them to answer a number of fairly simple questions, all on the same screen, and they're answered with simple yes or no answers in most cases. And once they press submit, the app then suggests a treatment or several treatments that would be suitable for that patient given their pre-existing conditions and the answers to the questions. The problem that DSM solves is it addresses some of the complexity associated with managing infection. And infection has unique complexity insofar as it's difficult for us to know if a patient has a bacterial infection, and if the diagnosis is made, which bacteria are causing the infection and which antibiotics might the bacteria respond to. And that requires specialist knowledge, but the DSM allows us to incorporate some of that specialist knowledge into the decision support. So when the doctor gives us information about if the patient has certain risk factors, for example, if they have a very severe or life-threatening infection, or if they've previously had antibiotics and might be at risk of having a resistant bacterium, then the DSM can suggest an antibiotic that takes those factors into consideration. And the upshot of that is that clinicians can feel more confident and less anxious about that decision, that they've had some support. It's not taking the decision away from them. We still require clinicians to apply their own thought processes, but it's giving them some backup to take into account individual patient circumstances. Well, setting DSM up is more straightforward than it might seem. We worked with the software developers at Horizon, and settled on a simple Microsoft Excel spreadsheet. And the beauty of this is that the team at MicroGuide have set up templates. So editors can simply edit a template that's already existing to incorporate their own treatment choices, or to tailor some of the questions that are asked, the decisions that are made within the system, but the template already exists. And so I allocate 1 to 2 hours to develop a decision support system from scratch for one common infection. Okay, to open up DSM, I open up one of our guides from Southampton. So I'm opening up the Adult Antibiotic Guide. And within body systems and respiratory body system, we have a guideline for community-acquired pneumonia. And if I pick community-acquired pneumonia antibiotic choice decision support, which is the top menu here, I'm given a single screen with 5 different questions. So the first question is about severity. Is the infection high severity or moderate severity? And if I pick, for example, moderate severity, I just tap on the button. Then underneath, the next question is resistance risk. Does the patient are they at low risk of antibiotic resistance or at high risk? And I might pick low risk for this example. Does the patient have a risk of Clostridium difficile infection? If I say low risk again. Do they have a penicillin allergy? In this case, I'm going to say they have a non-severe allergy. I'm going to tap on that button. And then finally, is the patient pregnant or not? And if I say not pregnant, you can see that immediately a dialog box pops up and offers a number of treatment choices. In this case, it's the antibiotic moxifloxacin, or as an alternative levofloxacin. Now I can toggle between different decisions. So if I change the penicillin allergy from a non-severe allergy to a no allergy, the box changes to offer a different treatment option, in this case amoxicillin plus doxycycline. Similarly, if I press the pregnant button, in this case, one of the drugs has been changed, doxycycline has been changed to azithromycin. So a clinician can see the impact of choosing different options in this decision support. And if you've forgotten what the definition of severity, high severity or moderate severity is, for example, then the little information button beside each question drops down some text that explains how severity is defined. For example, in our hospital, the severity criteria are there and the cutoff for high severity or moderate severity. And then there are references to the evidence with links to PubMed provided below. And once you've glanced at that and refreshed your memory, you can just press the I button again and that information disappears. And the same is true of all of the other questions and decisions here. I think DSM for me stands the best chance of improving patient outcomes for patients with infection. It's going to tailor antibiotic treatment so that they get treatment that works, the treatment that doesn't cause them any harm. And so I'd strongly recommend that hospitals that are currently using MicroGuide would consider looking at the DSM option. So there's great information provided on the new microguide.eu website, and that includes testimony in the form of forums, but also videos and demonstrations. And so once someone has browsed some of that information on the website, then it's just a matter of making contact with the MicroGuide team, and the rest is straightforward.